Hi, let's see an NCLEX video on pulmonary embolism. A pulmonary embolism is defined as the obstruction of one or more of the branches of the pulmonary artery by particulate matter that has an origin elsewhere in the body. There are certain sources of pulmonary embolism and it is classified in the following ways. First type is deep vein thrombosis. The source of this deep vein thrombosis is clot breaks loose from the site of origin, most often from the deep veins of the legs or pelvis, then travels to the pulmonary vasculature. The second type is fat embolism, which can be the result of long bone fracture, osteomyelitis, liposuction. The third type of the source of pulmonary embolism is air embolism that can be because of the CVC, that is the central venous catheter insertion. Negative intrathoracic pressure can allow air to enter a central venous catheter on insertion or if disconnected from a fluid source, as well as cardiopulmonary bypass and hemodialysis. Next type is amniotic fluid embolism. Amniotic fluid can move into the vascular space during delivery through the placental vessels. The last type is tumor emboli. Tumor sloughs off and tumor particles travel to the pulmonary vasculature. These points are important to understand about the sources of pulmonary emboli. In pulmonary embolism, you need to know about the virtuous triad, which include hypercoagulability, venous stasis, and intimal damage of vessels. The causes of all these predisposing factors we are seeing in this. The causes of hypercoagulability as a predisposing factor are cancer, oral contraceptives, dehydration or hemoconcentration. The reason for dehydration and hemoconcentration includes sickle cell anemia, polycythemia vera, abrupt discontinuation of anticoagulants. The second predisposing factor is venous stasis. Causes include prolonged bed rest or immobility, obesity, burns, pregnancy, vasculitis or thrombophlebitis, bacterial endocarditis, and any postoperative patient. The third predisposing factor or a part of this virtuous triad is the intimal damage of vessels, which can be the result of trauma, IV drug use, or atherosclerosis. Elderly patients are the most likely recipients of knee or hip replacement surgery due to the fact that many of these patients experience limited mobility due to the pain from their disease and have a high risk for deep vein thrombosis due to aging changes. These patients are at high risk for pulmonary embolism. The nursing assessment must be aimed at early identification of pulmonary embolism as a possible post-operative complication. This is a point which is very much important when you are learning about pulmonary embolism for this NCLEX exam. Pulmonary embolism and its classification. Mainly, it is classified into three: massive, submassive, and low risk. The massive pulmonary embolism, the manifestations include acute pulmonary embolism with prolonged hypotension requiring pharmacological support, right and left ventricular dysfunction, shock or cardiac arrest. The second type of submassive pulmonary embolism It's acute pulmonary embolism with normal BP, right ventricular dysfunction which is evidenced by echocardiogram, myocardial necrosis which is indicated by elevated troponin 1 and elevated brain natriuretic peptide. The third type or low risk, the manifestations are acute pulmonary embolism with normal BP, no right ventricular dysfunction, no elevated biomarkers that is troponin or brain natriuretic peptide. The common signs and symptoms of pulmonary embolism you need to know, which include dyspnea, accessory muscle use, pleuritic chest pain, tachycardia, tachypnea, crackles upon auscultation, cough, hemoptysis, unilateral lower extremity edema due to the presence of deep vein thrombosis, pain in extremity with redness and warmth. So sometimes question can come, select all that apply regarding the signs and symptoms of pulmonary embolism. So this slide will be helpful to you. We need to know about the contraindications through the thrombolytic therapy which we will use for pulmonary embolism. There are two types of contraindication, absolute contraindication and relative contraindication. The absolute contraindications include history of hemorrhagic shock, hemorrhagic stroke, active intracranial neoplasm, recent surgery, recent trauma that is less than or equal to 2 months, and active or recent internal bleeding that is 6 months. The relative contraindications of thrombolytic therapy include severe hypertension, systolic BP greater than 200 mm of Hg, diastolic BP greater than 110 mm Hg, non-hemorrhagic stroke within the last 2 months, surgery in the past 10 days, thrombocytopenia that is platelet which is less than 1 lakh, history of bleeding tendencies. So this is some of the points related to pulmonary embolism. Hope you understood this video. Thank you.